Good day everyone, I am Annaflor, a nursing student, and this is a return demonstration for eye and Otic medication. In eye medication, we have application of eye ointment and eye drops. So the purposes of eye medication are to treat eye infection, to relieve inflammation, to treat eye disorders such as glaucoma, to diagnose foreign bodies and corneal abrasion, to dilate pupil, to facilitate retraction, especially before the procedure, to lubricate socket for insertion of artificial eye, and also for the neonate and the newborn to protect their vision for with GERD's prophylaxis. So the procedure for this administration: first, verify the correctness of the physician's order and get the medication ticket. Do hand hygiene to deter the spread of microorganisms. And then um, gather all the equipments that we are going to use for these medications. I have here the prescribed medication, the tissue paper, the cotton balls, the water, the actual water, and the nursing consideration for this medication, for this administration medication, is the SR gloves is only worn for post-operative cases and if the drainage is present. So after that, explain the procedure to the patient. So, good morning, ma'am. I am Annaflor, your nurse for today. May I first know your name, ma'am? Annaflor Bantayan. Okay, so in this administration of medication, ma'am, we have two types of position. We have the supine or the lying position, and also we have the sitting position. So, may I ask what is your preferred position, ma'am? Lying position. Okay, so in us okay, so lying position, and then um, clean the affected eye of the patient with cotton balls moistened with normal saline solution from inner to outer canthus. Can you please close your eyes, ma'am? And then uncap the medication container. So if the patient is in lying position, instruct the patient to look at the upper portion of the head. And then if the patient is in sitting position, instruct the patient to look at the ceiling. Okay, ma'am. So before I administer the medication, ma'am, can you please look at the upper portion of your head? Okay. And then put the eyedropper close to the eye, 1/2 inch at the conjunctival sac, and then avoid touching the eyelid and also the eyelashes. Um, yes, avoid touching the eyelashes and the eyelids, which startle the client and can cause blinking. So this is to prevent eye injury and dropper contamination, and blinking discharges some medication from the eye. So we will put the eye medication 1/2 inch at the conjunctival sac, and then instill the prescribed amount of the medication. And then instruct the patient to gently close your eyes. So can you please gently close your eyes, ma'am? And then put pressure on the side of inner canthus to to prevent the medication from flowing into the tear duct. And then hold for 1 to 2 minutes. Okay. So after the eye drops is the application of the eye ointment. So in applying the eye ointment, just follow all the steps in instilling eye drops, such as verifying the correctness of the physician's order, um, doing hand hygiene, and also the upper version of the materials needed, of the equipments needed. So in application of the eye ointment, apply a thin layer of eye ointment from inner to outer canthus along the lower eyelid, inside the conjunctival sac. So, can you please close your eyes gently, ma'am? And then wipe the excess medication with tissue paper. So this is to provide comfort to the patient, and the direction of the wipe reduces the risk for friction. And then apply eye patch if indicated. And then after that, dispose all the sold supplies to the proper receptacle. And then all the procedure, document all the procedure, including the dose, the route of administration, the appearance of the client's eye, and the response of the client to the medication, and all the information related to the administration of medication. So next, we have the Otic medication. The purposes of Otic medication are to treat infection, to relieve pain, to soften and remove impacted cerumen, to produce local and anesthetic effect, and also to facilitate removal of foreign bodies such as solid materials. So first, verify the correctness of physician's order and get the medication ticket. And also check for allergy, because allergies are contraindicated. And then do hand hygiene to deter the spread of microorganisms. And then explain the procedure to the patient. Good morning, ma'am. I am Annaflor, your nurse for today. May I know first your name, ma'am? Annaflor Bantayan. Okay, so I'm going to administer ear medication for your ear infection. And may I ask you to lie on your side, ma'am, for me to be able to administer the medication? Okay. And then and assess the affected ear of the patient using the pen light. And then next is apply the eye medication. So if the patient is 5 years old above, pull the pinna up and back, and then if the patient is 5 years old and below, pull the pinna down and back. It is to strengthen the auditory canal. And then uncap. And then place the medication 1/2 inch above the ear, and then instill the prescribed amount of the medication. Pull the pinna up and down and up and backward. And then instill prescribed amount of medication. And then instruct the patient to remain on lying side for 2 to 3 minutes. So can you please remain on your position, mom, for 2 to 3 minutes for the medication to be properly dissolved, to be proper. And next is put pressure on the tragus. And then after this is document all the procedure, including the dosage, the response of the patient to the medication that you have administered. So that is the procedures of administration of eye and otic medication.